Even though we classify many of these patients as uncomplicated, they're really much more complicated than we think, and I really don't think that this paradigm of an uncomplicated type B is very often found in the clinic. I think we need to understand that. And so when we look at some of these variables that have been studied, we can see that refractory pain is a variable that if somebody has refractory pain after the initial presentation of a type B, that can be a significant differentiator in outcomes for those patients. In addition, we need to revisit or reconsider the sizing diameters for these patients. And so you could see that this study showed that an aortic diameter greater than 4 centimeters at presentation of the type B was a differentiator and had a higher aortic-related death in these patients. So we need to think about our sizing criteria for type B dissections, not just the dissection itself. When we look at the false lumen diameter, it's something that we don't normally measure or record in our procedure notes or in our radiology reports, the diameter of the true lumen, but when it's greater than 22 millimeters, there's a significant differentiation in outcome in those patients. And finally, the size and location of the entry tear. We talked about entry tear management. The size of the entry tear can certainly affect that outcomes of these patients. And when we looked at different kind of anatomies of these dissections, we found that greater than 1 centimeter proximal aortic tear had a much different survival and was really a need to be treated, even though the patient was classified as uncomplicated. And many of the patients we have, you can see very complicated anatomies. So I want to kind of also wrap that up in that when we start to combine these variables, they're all very important, but when we combine these variables, that's when the power of differentiation becomes available. So I think we really need to revisit with these patients that are uncomplicated and understand a little bit better up front at the time of presentation which patients really can benefit from therapy.